You lost a tooth, you were offered an implant, and it all seems simple. A titanium screw, a crown on top, a new tooth just like your own. But deep down there's anxiety. What if it doesn't take? What if it hurts? What if your body rejects the implant? Every day I see patients who come in with these fears. Some people put off treatment for years, while others go through with it and then face pain, inflammation, or even loss of the implant. Most often, it's not because the doctor made a mistake during the procedure, but because no one explained in advance what specific risks exist in their case and what you, as an implant wearer, need to do to make them last a lifetime. Today, I will tell you who absolutely should not get implants, why an implant might not take, and how to prepare so that the implantation goes smoothly without pain or fear. Watch this video until the end to understand how to avoid complications and regain your confidence. An implant is a titanium root or titanium post that is placed directly into the jawbone. In other words, it's an artificial root onto which a special connector is attached, and then the crown is placed on top. This is the foundation for our future tooth. Why do they use titanium specifically? Titanium is used in medicine because it's the only metal that the body doesn't recognize as foreign, so the rate of acceptance or osseointegration is very high. What does it mean when we say the implant has taken? If we look at the micro level, we'll see that our implant has special pores or microsurfaces. And it's into these pores, these microsurfaces, that the bone of our jaw actually grows. And that's what osseointegration is.
How many types of implants are there in general, and how do I know which one is right for me?
As for the types of implants, there are a lot of them, by size, by modifications, by thread type. That's why only the implant surgeon can make this decision. For every individual situation, there's a specific implant. I'd even say for each tooth and for every specific need. For central teeth, for the front teeth, that's one type of implant, and for molars, it's a different type. The implant your doctor decides to place is the one you should get. So choosing an implant yourself is not only practically impossible, but also unnecessary. Who is dental implantation contraindicated for? The first condition is diabetes, more specifically, its decompensated form. This is when a patient is taking diabetes medication, but their blood sugar levels are uncontrolled. In other words, when the numbers fluctuate, sometimes high, sometimes low. And with this form of diabetes, implantation is contraindicated. The second contraindication is cancer. That is to say, this applies to patients who are currently under the care of an oncologist and are undergoing cancer treatment at this time. This is because, in general, any intervention is contraindicated for such patients, not just dental implantation. Any other surgery or physiotherapy procedures are also avoided so as not to provoke further worsening of the disease, because any surgery is a stress for the patient. The third contraindication is patients who are taking bisphosphonates. These are medications used in the treatment of osteoporosis, or sometimes bisphosphonates are prescribed by an oncologist. These medications are dangerous because not only might the implant fail to integrate, but placing the implant can trigger severe inflammatory processes in the bone up to and including abscesses or phlegmon, where the implanted device can fall out together with a piece of bone. The fourth contraindication is immunodeficiency conditions. Most often we are talking about HIV infection, or more specifically, its advanced form, AIDS. Implantation is not allowed in cases of AIDS simply because the body's reserve capabilities are weakened, almost non-existent, and the immune system will not mount any response. And of course, an implant will never take hold in such a situation. Furthermore, the fifth contraindication to consider is an age of under 18 years, and in certain exceptional cases, even under 21. This specific restriction exists because up until the age of 21, the complex development of the human dental and jaw system may still be actively ongoing. In other words, the body is still growing and the jaw may continue to develop. So if we were to place an implant before the age of 18, our jaw would continue to grow, and the implant could either protrude or, on the contrary, sink, or the structure we've already placed on the implant could simply break apart because the bone, or rather the jaw, is still growing.
And how is an implanted tooth different from a natural one? Is it worse or better in any way?
Well, I don't think it's quite right to say it's worse or better. As a matter of fact, a dental implant and the meticulously crafted crown placed on top of it are absolutely indistinguishable from an aesthetic perspective from your very own natural tooth. If the implant has already integrated and we've placed a crown on it, then in terms of strength or function, it's also absolutely no different. The only thing perhaps is that, let's say, the implant can be tricky when it comes to symptoms. That is, if the implant becomes inflamed or there are any issues with it, the implant itself doesn't hurt, unlike a natural tooth. In other words, a natural tooth will signal that something is going on, and the patient can seek help in time, but with an implant, this doesn't happen. That's exactly why we ask patients to come to the doctor every 6 months, so the doctor can monitor and understand what's happening with the implant. Because that's the tricky part about implants. Since it doesn't have nerve endings, it's just a regular titanium post, these signals simply won't come from it. That perhaps is the only real difference between a natural tooth and an implant.
So why can implantation be done incorrectly?
Actually, that's a bit of a provocative question. Is it right or wrong? It happens that, let's say, in the absence of a 3D scan or proper diagnostics, we might not plan the surgery correctly because it's precisely the 3D scan that allows us to determine the height and thickness of the bone, select the appropriate implant, and understand whether there are any inflammatory conditions in the bone near where our future implant will be placed. So most often this mistake can be due to this underdiagnosis, so to speak. Right? So that's the first reason, as you mentioned, for improper implant placement. There are certain rules we follow when placing an implant. That is, the implant is placed and there must be a specific amount of bone around it, calculated precisely in millimeters. On the left, on the right, and on top. This is what it means to select the right implant. Accordingly, the doctor selects the implant based on its thickness and height, that is, its length. Also, as you mentioned, improper implantation can occur when the patient is not prepared for the surgery. What does that mean? It means not having done the necessary blood tests, which allow us to predict how long or even whether it is possible for this patient to have implants at all. These include blood sugar, cholesterol, and total calcium. There are many indicators that help us understand what is happening systemically in the body. So these are the two main reasons. Yes, these two primary and significant reasons can, as you have just said, directly affect whether the implant is placed incorrectly or not. Now, I will talk in more detail about the patient's own potential mistakes that can unfortunately cause the implant to fall out over time. The first and most critically important reason to consider is the patient's personal oral hygiene. That is, this happens when the patient does not take care of their teeth, does not brush them, or brushes our artificial crown incorrectly, which is just as susceptible to tartar. And in the same way, the gum around our artificial crown, our artificial tooth, is also prone to inflammation if there is plaque on the artificial crown. That's why hygiene is very important. Also, the patient frequently neglects to visit the dentist for professional cleaning performed directly while sitting in the dental chair. The second reason is an extremely significant and critical factor that many people tend to overlook, completely ignore, or simply do not take nearly seriously enough. It's smoking. Smoking really is a very serious factor. By the way, not only during the healing period, because we recommend our patients refrain from smoking after implant placement. This affects the integration of the implant. Smoking also affects the subsequent use, functioning, or lifespan of our implant. This means that smoking or nicotine causes dryness of the mucous membrane. The gums become drier and more fragile. It becomes prone to inflammation, it gets dehydrated, and it starts to recede. And in fact, the gum is an important buffer between the implant we've placed and the external environment. It is only thanks to the gum that infection from the oral cavity does not get inside the implant.
And why is it important to maintain hygiene?
Maintaining hygiene, it's all the same reasons. That is, if plaque accumulates on the artificial crown, real tartar will form, just like on your natural teeth. And this tartar will start to push the gum away. Furthermore, and as I have previously said, the gum tissue acts as a protective buffer, a protective layer between our implant and the crown.
Is it possible that I do everything right, but the implant still falls out?
That happens extremely rarely. And most often, I think it's a matter of underdiagnosis. That is, when we miss something, didn't notice some disease, I think that's extremely rare. But you can always leave a certain percentage, so to speak, for individual characteristics of the body. Sometimes it really is the case that a patient is just unique in that way. And you can also refer to combined pathologies when a patient has other somatic diseases that also affect, let's say, the lifespan of the implant we've placed. But this percentage is very small.
So what exactly am I, as a patient, absolutely not allowed to do with implants?
Well, let's put it this way. As a patient, you can't really do anything to the implant itself because it's placed deep in the bone and covered by the gum on top. And even in some cases, when we place the implant, there's a large cap of bone that forms over it. So you really can't do anything to the implant itself. And the only thing you can really do, as I mentioned before, is that if you don't clean properly, an infection can reach your implant. It starts at the crown, then moves down to the connector, called the abutment, and through this abutment, the infection can travel all the way down to the implant itself. So all you can really do is probably influence it through good hygiene, and as I mentioned, certain diseases or smoking can also have an effect over time, but it doesn't affect the implant directly. It affects the tissues that protect the implant, and eventually the implant itself will suffer. So what exactly can you as a patient do with implants? Yes, I think pretty much everything. You can chew comfortably. The only thing is, of course, the load that an implant can withstand is much greater than that of a natural tooth. So experimenting, by the way, there are patients like this, there have been such cases. Experimenting to test the strength of your artificial teeth is not recommended. So biting through wires, opening beer bottles, I don't know, biting bones, gnawing on bones, actually breaking bones, right? Maybe chicken bones are still somewhat okay. But let's put it this way, testing them for strength is definitely not recommended. Any absolutely normal, understandable force that we use on our teeth should be fine. And in principle, the implant can handle any normal, everyday load.
And how should a patient prepare for implantation so that it goes painlessly and without fear?
Well, first and foremost, as I mentioned, it's all about your mindset. So first of all, you really need to meet your doctor, trust them, and talk to them. As soon as you trust them, that's it. You're already at least 50% mentally prepared. Then, of course, you need to mentally prepare yourself for the implantation. That is, you're given a specific day and time, and your task is not to watch a bunch of videos about it online, not to work yourself up, but to treat it, yes, as a medical procedure, but one that is completely painless. You just need to go through it. If you're very anxious, you can start taking some calming drops a week before the implantation, like motherwort, valerian, or some tablet form medications. And then, with peace of mind, go for the implantation on the appointed day. What alternatives are there to implantation? Let's consider only the situation where we're missing just one tooth. There are two teeth on either side, but the one in the middle is missing. And now we want to restore this kind of gap in the dental arch. The first alternative, of course, is the traditional one, crowns. When we grind down the two adjacent supporting teeth, as we call them, we place a bridge on them in the form of crowns. And in the middle, we have this kind of crown, which will cover, or a pontic, or it's called a bridge, that will cover the gap we have. With this method, we grind down these two completely healthy teeth, and they are ground down quite a lot. But this is an alternative. If someone is really afraid or doesn't mind grinding down the neighboring teeth, it's a good option and you can choose it. The most important thing is to close and restore our dental arch so that all the teeth are present. Honestly, if I were to put myself in this situation, I personally wouldn't recommend this method. But every patient makes their own choice. They understand all the pros and cons. The second method of restoration is really very simple, and it's quite suitable as a temporary solution. This involves making a small removable denture. It's sometimes called a butterfly denture or an immediate denture. It's when a small artificial tooth is put in place. You put it in, go about your day comfortably, and take it out at night. But the main advantage of this kind of denture is that it prevents your teeth from starting to shift. That's why it's important to get it made in time. And as a temporary solution, while you're thinking things over, or maybe while you're getting ready or preparing financially, right? You can have this kind of denture made and wear it for a while. That's also a good solution. Aesthetically, nothing is noticeable. You have a complete row of teeth, but it's a temporary solution. For example, you can't chew with this kind of tooth. Most often, these are the central or front teeth, but as a solution to restore the dental arch and to maintain it, this is also an absolutely good alternative. As soon as we lose a tooth or a gap appears or there's a defect like a missing tooth, nature abhors a vacuum and our neighboring teeth will simply start to shift. In other words, they will move to fill that space. That is why our primary task is to halt this progression and address the issue immediately in time, so that our teeth do not suffer further damage. Otherwise, in the future, you will have to get braces or straighten those misaligned teeth before you can successfully place a permanent implant. Can you imagine, because of a single missing tooth, a neighboring tooth on the opposite jaw can start behaving incorrectly, and this will also eventually require certain treatment or intervention to bring it back to its place. Like the video, subscribe to the channel, and take care of yourselves